I would like to introduce our first speaker, Dr. SOPHIA KORB. She's a Ph.D. with clinical experience with children and families with trauma, individuals with chronic psychiatric disabilities, and people living with HIV/AIDS. She also works with veterans, people using substances, and people who are formerly incarcerated. Her research includes psychedelic experiences, harm reduction, trauma-informed therapies, applying machine learning to social science contexts, and evidence-based policy and therapies. Most recently, she's been working with microdosing psychedelics. That's what she's going to talk with us about today. And she's been working with Jim Fadiman, who is sort of a psychedelic elder in the field. But this is her work and her presentation. Dr. SOPHIA KORB.
Hi, everyone. I'm very grateful to be here on the bar mitzvah year of Horizons. Around 5 years ago, Jim spoke from the main stage, the same time slot, and I was in the audience trying to assist as a student. And so this is sort of a follow-up on what happened since then. So around 5 years ago, around 8 years ago, I was a master's student, and Jim Fadiman said to me, this is at the Institute of Transpersonal Psychology, we don't have anyone who knows math and statistics. Could you be the math and statistics person for my research group? So I said sure, because I needed the money. And I didn't know anything about psychedelics. Had never used, because it's completely psychedelics naive. And after I finished my master's, I became less psychedelics naive. After reading and analyzing a lot of data from Jim. So around 5 years ago, we presented on some high dose information. The different types of experiences that people have at different dosage levels. And at that time, we wondered what would happen if people took very small amounts of psychedelics. In fact, the inventor of LSD, suggested that taking very small amounts of psychedelics might have health benefits. So Jim said to people at Horizons and at different conferences, if you try it, let me know. And so when I started working on this project, we were receiving handwritten journal entries from people who are microdosing. Initially, when the media started reporting on this, they kept on saying this was something people were doing in Silicon Valley to increase productivity. And I got really stressed because I was like, oh, we don't want to use psychedelics for capitalism. Like, what is going on? And my place at Horizons has always been like in the back with the anarchists and the punk kids. And so that isn't totally what we see. What we see, in fact, is that, well, a bunch of things. But when people use microdosing, they sometimes find themselves more productive at work, but sometimes they realize, hey, being a banker isn't for me. And they leave being a banker, and they do something else. So the reason we have this old tablet is one of the first examples of writing that we have, and it's old astronomical observations. It's some of the first science we know of, is people recording what they saw, people recording their own experiences. When I started working for Jim, we were getting these like handwritten journals. Someone who I don't know sent people microdoses and journals with our address. I seriously don't know who sent these. So I sort of organized things and started some scientific data collection, and we have some demographics. So at this point, these are a little bit old, so we have something like 8,000 people participating in microdosing. I have 11,000 pieces of correspondence between us and people who are microdosing, so not a small sample at all. And not just computer programmers in Silicon Valley, but a wide variety of professions, people in the building trades, professors, artists, writers, stay-at-home mothers. We asked people, are you using this for medical benefit or for like wellness enrichment? And there wasn't a lot of difference between the two groups of people. And we asked people what they were experiencing. If people had very like high stress jobs, like they were an aircraft mechanic, we suggested maybe you could be in our control group. maybe you could just fill out this survey and not microdose, because we're a little stressed about people like in the Air Force microdosing when we're not sure exactly what was going to happen. So this is not a randomized trial. It's very much not a randomized trial, meaning we put the higher risk people in certain cases in the control group. And we dissuaded people who seemed particularly disorganized, so people with psychosis, people who had terrible experiences on LSD 20 years ago and wonder if microdosing can help them. I've suggested, hey, maybe not microdosing as the way to get over this. Maybe go to therapy. And so those people contributed to our control group. So of depressive symptoms, it was around 60% of the control, 80% of the active, which I think is, unfortunately, around what we see in the normal everyday population as well. The average age is 34. In all of the samples of all groups, somehow, it's 34, 33. And this is an earlier moment, but out of 1,600 responses for what is your sex or gender, we had 21 trans or non-binary people. We don't see a lot of sex level effect or gender level effect, but what we did notice is that for people taking hormones, either perimenopausal women or postmenopausal women or people who are transitioning, that estrogen had a potentiating effect on microdosing and androgens had a dampening effect. So I'm always worried the media is going to hear this and say like, oh, young people are taking hormones in order to trip harder. That's not what I'm saying. I'm saying that we noticed that when people took hormones, they had a stronger effect with microdosing. And microdosing means taking a very small amount of psychedelics. If you see things that are shiny or wavy, you've taken too much. Obviously, there's a lot of ethical concerns and limitations in what we did. We didn't provide the substances, so we don't know if people had LSD or psilocybin, and those aren't the only substances in the study. There's 18 different substances. And so this wasn't through the protective procedures of FDA approval. There's no amnesty for people. There's no protection from government authorities. And so people who are willing to do this sort of thing, they might be really desperate and vulnerable. They might be really suicidal. So we tried in many ways to protect the rights and to be responsible in working with people who might be so vulnerable. As I mentioned, this is not a randomized controlled trial. It's not blinded or randomized. So the placebo concerns, the power of knowing that you're in a trial might be amplified. Selection bias means that people who are willing to microdose might be people who LSD or psilocybin worked for in the past. So those people might be more likely to microdose and might be more likely to have a positive benefit. We don't actually want to encourage people who have never tried LSD before to try microdosing for a lot of really good health reasons, right? In general, LSD and psilocybin are safe substances, but if someone were vulnerable to psychosis or mania, this could trigger an episode. So there's definitely selection bias here. And people might be more fearful or anxious or uncertain because of the illicit nature of what they're doing. Not in all of the places where this happened was this illicit. So in the Netherlands, with certain substances in Canada, people were able to do this legally or gray market legally. So those people might be less anxious. What did we do to mitigate the risk and harm? We read like all of Arrowhead. No, I wrote a computer program to read all of Arrowhead. So I'm not going to take responsibility for DrugBot, but DrugBot read all of Arrowhead for us and analyzed it. We collaborated with people's physicians. So if people wanted to participate in this and they wanted their doctor or their psychiatrist to talk to us, I talked to a lot of psychiatrists. We suggested people get reagent testing through DanceSafe and through Amazon and through the Harm Reduction Coalition. We told people very explicitly that there are risks and possible harms. We asked people to choose anonymous code names when they corresponded with us. This was confusing when they chose our names. And looking back on it, I should have expected that, but we didn't, and so we had to hash everyone's secret names before we analyzed everything. And we suggested people use Tor, which would be a way of using the internet where the government would be less likely to track you. Jim has emphasized to me that we shouldn't really push people to use Tor because that might make them more afraid. So it's an option for people. The way that we did this, not as a blinded trial, not as like how science should be, do affect the results, but they affect them in lots of positive ways too. Because we're not scientific observers who are separate from this community. We're part of this community. These are real relationships that we have with people. So as we go forward, and at the end, we'll talk about handing this off to clinical research and randomized controlled trials, we definitely want to thank all of the people who participated and for being so welcoming to us and in sharing their stories. So we had ongoing communication when anyone had like an adverse effect. So one thing we discovered is that people with color blindness, specifically red-green color blindness, which is the most common and mostly found among men, they had visual effects that lasted way past when they microdosed, like a week past. Like they couldn't drive because of the tracers. So we told everyone in the sample, like we contacted everyone and said, hey, if you have color blindness, this is a thing that's happening. Which isn't necessarily how you would do a randomized control trial, but in this sort of thing, if you find a harm, it's our responsibility to report it, to let people know. And we let people change their dosing regimen as they wanted to. We thought that every 3 days or every 4 days would be a good regimen because we had this idea that LSD would last in the body for a couple days. When people leave the study, what they tend to do is either dose every week, well, if they continue to microdose, which most of them do, or most of the people who finish the study do continue to microdose, either every week or every month. A comic. So we wanted to have more information about microdosing. I wanted things to be different. And then things got really different. So now we have all of this information. We have thousands of journal entries to analyze. And this became quite a big media ordeal. We're talking to BBC and Forbes and New York Times and The Atlantic, and Michael Pollan is here. We spoke to lots of reporters. Things became different. So here are some results. I'm going to leave a lot of this for questions. These are the themes that we found after reading thousands of stories. Obviously, people have their own individual experiences, and I recommend talking about your experience if you feel safe with your friends. All of these themes were found in more than 30% of the sample. So we asked people, in part of the sample, to report their emotions every day. We used a scale called the PANAS, the Positive and Negative Affect Scale, which is validated for the normal population, which means people like us, people without psychiatric disabilities, should basically work for all people. And it says like how depressed do you, or how sad do you feel? And you choose a number between 0 and 3. We looked at both people microdosing and people who weren't microdosing and saw what happened to their emotions. So this is the really exciting thing. So I was sure it was a placebo effect, by the way. Like I'm Scully in the dynamic of me and Jim. Jim is Mulder. So I was sure it was placebo effect for months. And when I looked at the control group, I saw that people were getting better. They were getting like, 15% better. And I was like, oh gosh, it's definitely placebo. So then when I looked at the active group, so the active group got 54% better in terms of depression symptoms and 30% better in terms of anxiety. So for people with mixed anxiety and depression, if the anxiety is the more serious concern, those people were sometimes not able to tolerate microdosing. Because most psychedelics are slight uppers, so it's perhaps like having a cup of coffee, so that made them more anxious, so they stopped. For people with mixed depression and anxiety, where depression was the more serious effect, once they got through 11 days, there was a reduction in anxiety. So those people report an openness and lack of anxiety. So I'm going to share these quotes. I have noticed that my mental chatter is considerably less than it was prior to this study. It was near constant before, and not very positive. First thing every morning, my mind was always a raging flood of responsibilities, reminders, and thoughts unnecessary. I remember telling my husband, you know that time in the morning when you're almost fully awake but there's nothing on your mind? It was very fleeting. Now my thoughts are quiet and calm with a gentle flow. I'm so grateful. So that's great. I mean, wouldn't we all love to have experiences like that? People reported change in their own introspection. Now this might be because we're asking them to journal, right? But this is more than we see in the control group. So someone says, my self-talk feels like from a third-person view. So meaning they're able to get more distance from their own stuff and able to see what's going on more clearly. Of course, people said they had more energy and were more fully engaged. So I'm feeling very energetic, very focused, very alert. It's the same as taking Adderall, but without the jittery or the crash after, so that's wonderful. So we see a lot of people actually selecting to reduce their ADHD medication, usually stimulant, but including non-stimulant medications like Strattera, while using microdosing instead. So they're selecting microdosing, which is a once a week or twice a week regimen instead of an everyday stimulant. We don't know, we have information about the side effects and long-term effects of those stimulants. We don't have the same kind of information about the long-term health benefits or downsides to taking LSD or psilocybin. People have reported a lot of change in their interpersonal and social lives, and we asked people's wives and husbands and parents to write in too. And they said that their family members were more patient and more gentle and more kind. One person said, I'm having unusually productive and pleasant social encounters with people I normally don't get well along with. So in 2014, there was this break on the seal of LSD research, and Gasser in Switzerland did 2 studies, a safety study and a study of people at the end of life. And they report less end-of-life anxiety after having a full trip experience with a therapist. So Gasser in his writing points to these themes as these ideas as possible mechanisms for why the change happened in high-dose experience. So one thing he says is that the cognitive experience might have changed people. So we looked through our microdosing data to see if the same mechanisms that they saw in the high-dose study we could see in the low doses as well, and we found some evidence of this. The cognitive experience is when people who take LSD or psilocybin or whatever see things from a different point of view. They take a step back, they're able to see hierarchies as not necessary in the same way. They're able to see the way that things are interconnected in a different way. So someone writes, the primary difference I notice is that curiosity outweighed fear. Difficult problems were easy to start. I didn't mind making a mess in order to find and examine solutions. I was eager to get into something and just see where it went, but also able to clearly form facts in my mind or on paper for possible implementations. So that's someone who's microdosing, who's reporting a similar type of cognitive change that people who were macrodosing were seeing as well. The second theme that Gasser points out is the psychodynamic experience, meaning that things that were repressed, especially say, sort of family relations, might come up for people again, and then they're able to work through that material. This can be very dramatic in high-dose experiences. We talk a lot about integration and integration circles, and a lot of that stuff has to do with family stuff that comes up. So we see the same thing in low-dose experiences as well. So I noticed the anxiety had gone. I felt clear and full of energy. My depression has been causing me to drift away from friends and family at an alarming pace over the last 2 years, often feeling great anger towards family and frustration towards friends. This first time microdosing almost instantly gave me the urge to reach out to my friends and family. It's like I felt anxiety, but without the anxiety. It's a very strange sensation for me. The next few days, I felt very chilled and relaxed, and with no anxiety or fear. So I think that's interesting. It's definitely something to follow up on. The third theme that Gasser points out is the psychedelic experience itself, so the high-dose dramatic experience. What we failed to do in our study is ask people if they were also having high-dose experiences. You know why? Because it didn't occur to us. So we don't know if that was a factor in people's change with microdosing also. That's something that we are following up on now. We also propose a new theme that we see in microdosing and that people may see after macrodosing experiences as well. And that theme is flow. So flow means when people we've all had this experience of doing something and you don't know the time is going, you're just totally absorbed in the experience. There's all this work to figure out what makes those experiences more likely. They happen in lots of workplaces and with vocations and avocations and occupations. So obstetricians delivering babies and artists, psychologists, stay-at-home mothers, depending on sort of the difficulty of the experience and the emotional engagement, people have these experiences of flow. They get in the flow. So, this person writes, the way I do my job has changed quite a lot. Earlier, I used to be overly focused, losing myself in my screen and in thoughts for hours and hours. It's hard to describe and even harder to find an explanation for how easily I get things done now. It's like I get more work done at a higher quality while taking less effort. I have mental clarity and I'm able to more easily take a few steps back and adjust the right things. Another part is my improved social and communication skills. This helps me match the right people to get work done I'd previously do myself. Emotionally, I'm more balanced, no more depressive episodes. I actually feel blissful most of the time. My creativity is heightened and I'm writing more because I'm no longer tired after work. So, we're very curious to see if in the randomized control trials coming up and in macrodose experiences, if they're also able to find experiences of flow. So let me explain what we're doing next and sort of what's happening in the field in general. There's people publishing at University of Toronto and York and in the Netherlands doing surveys, in the Netherlands doing research. Because mushrooms are legal there, they're able to go to a coffee shop, give people microdoses, and do a study. So there's a small working group of, 12 different research groups. That's kind of a lot. 12 different research groups who are studying microdosing or low dosing right now, and we are collaborating. So collaboration. We have several publications coming up. We are doing follow-ups with people. There's been a lot of weird medical things that people have reported with microdosing. So people with herpes zoster, which is shingles pain, people keep on coming up to me crying after I give these talks because microdosing solved their shingles pain. I'm happy for the hugs, but I had no idea that was going to happen. And so also people with paralysis. Or people with phantom limb syndrome, so people who have lost a limb, and sometimes this is very painful because the limb that they have lost is cramped in some way. So those people are reporting a reduction in pain. We're doing follow-up studies with people with traumatic brain injury. We are not doing follow-up studies with people with autism, and the reason for that is because consistently, people with autism spectrum disorder write to us and say, it takes me way more psychedelics to trip than it does other people, 5 times. It takes me 500 mics to have the same as someone else doing 100. So if I'm microdosing, can I also multiply that by 5? So no. Please don't take 125 mics and say that you're in our sample of microdosing because it's terrifyingly dangerous. And also our friend Alicia Danforth, who I think is in Sweden, keynoting, said that people, especially parents of children with autism, are so desperate and so frustrated that they'll give their children almost anything. So not to really discourage people from giving children psychedelics because we don't know about the harms and what would happen with developing brains. So there's, it's on our website now, there's www.microdosingpsychedelics.com. Our email address is psychedelicsresearch@gmail. These are our email addresses. So we are putting our data, which is disidentified, we've removed the names and so on, up on the web. This is from Hefter Foundation, from Amanda's work. So this is a connectome. It shows the ways that things are connected in the brain. But our experience during this research has been that not only that different ideas in the brain get connected, but people get connected. We've gotten connected. So I feel a lot of gratitude to be up here. One of the things we've been talking about in the back over the last few years is that there haven't been enough women and people of color on stage. So I'm really glad to be a Latina here on stage, and I hope this is a trend that can continue as Horizons grows into and accepts the responsibilities of all the bar mitzvah responsibilities of an adult. So yeah, I think I have a few more questions. I'd love to take people's questions. Jim always says questions end in a question mark, which means that your voice goes up at the end. Yes.
I wondered how much information there is, if there's any, anecdotal or otherwise, on replacing antidepressants, reuptake, serotonin and norepinephrine type drugs with this. You have to ramp off that stuff pretty slowly. And if you take them at the same time, is there a concern about serotonin syndrome?
So I was very nervous about people getting serotonin syndrome. No one did. It's very small amounts of LSD or psilocybin, so that might be why.
They kept going with their drugs?
1 second. Yeah. So I was anxious, and then no one did get serotonin syndrome, though we were worried about it, and we warned people about it. And people did reduce the amount of antidepressants that they took, both SSRIs and SNRIs. They did that slowly we encouraged them to do it under their doctor's supervision. As many people know, there's pretty serious withdrawal or discontinuation syndrome from those medications. And some people were reporting that the microdosing was able to reduce the amount of brain zaps or the discontinuation or withdrawal symptoms that they were having. Some people stayed on. Our website has 146 drugs that people were able to take safely with microdosing. That's what they reported. We were very worried about lithium because in high-dose experiences, lithium and LSD can cause seizures, even though neither lithium nor LSD cause seizures on their own. So we were very concerned about people taking lithium. We have 20 people who took lithium microdosing and they were fine.
Of the most challenging cases that you did not recommend to microdose LSD, they went to the control group, and 15% of those people, those most challenging cases, saw improvement.
Yeah, so what we ask people to do, the filling out their emotions every day and journaling, is an intervention. Yeah. So what we ask people to do is an intervention that does help people get better. And that it could also be a placebo effect. But if you keep track of your emotions every day, and this is a free app, it's called Mood Scope, people who keep track of their emotions and journal get better. Because what we pay attention to and what we give energy to, what we give intention to grows. 15% is a low amount, but the time scale is very long. So we're talking about like 270 days. So that might explain some of that. Yeah.
Was the microdosing amount the same for all people? And if you can, please disclose what it was, the actual amount, how much, how many milligrams?
So there's amounts on our website, and what we recommended for substances that we didn't know about is to start at 1/20th, meaning 5% of a recreational dose. So say Ibogaine, right? So we didn't know what an Ibogaine microdose is, though Ibogaine turns out traditionally is used in microdoses by the Bwiti people. So yeah, we recommend that people try 5% and then adjust down or adjust up based on how they felt. Yeah.
Is there any research or follow-up in what happens when people stop?
That's what we're doing right now. We're asking people who didn't continue or people who stopped why they stopped. So that's ongoing. Some people have reported they stopped because they weren't in the right life space. They're going through a divorce or something. And some people said it made them too energized. And I'm still doing interviews with people right now.
Sophia, did anybody look at the difference between psilocybin, LSD, or anything else that was microdosed with, or did you not parse the data that way?
Yeah, so I tried to, and people in the mushrooms community report different effects for high dosing of different types of mushrooms. I can't tell a difference, and DrugBot can't tell a difference. Like there's no data difference between those groups. So if they're feeling something different with different types of mushrooms, it's not coming across in the data.
And could you maybe just list a couple other things that people were using? Like was anyone doing low-dose ayahuasca?
Yeah, ayahuasca, 2CB, 2CI, all of the DOIs, DOX, whatever, DOC, DMT, ALAD, right? All of the alpha-betamines. Mm-hmm.
Okay.
Any negative effects?
Mm-hmm. So negative effects that people reported were mostly increased anxiety in the first 11 days, and people who used mushrooms rather than purified psilocybin reported GI, like nausea effects. When we suggested to them to use purified psilocybin, if they could do that instead, those side effects decreased.
Do people continue this indefinitely, or you said that they often go to like a less frequent, but do some people just decide I've finished with this and I just am stopping because I've done what I need to do?
Yeah, so some people do finish and some people are continuing. We have people, someone actually in Toronto 2 weeks ago was one of our very low dose people. They had measured wrong and they thought they had 10 micrograms and actually had 1 microgram. And they had a complete cessation of all migraines. And so she's now gone up to 3 micrograms. But in general, people have been reducing the dosage that they take, that either because they're like learning something or their brains are learning something. A lot of people are continuing once a month, and a lot of people also stopped because they felt like they accomplished what they needed to.
Hi, would you be able to share any information about the experiences of mental health professionals and clinicians microdosing while they're working?
That's a great question. So I haven't selected that group out specifically, and I have not microdosed while seeing clients, so I can't speak from my own experience, but I can remember that some therapists, people try it usually on the weekends first because you don't want to like accidentally things to get wavy while you're at work or driving. And this one group of people in Louisiana who were microdosing all together to see if it affected their blood glucose level. They didn't understand the difference between fractions and percentages. So they took 20% rather than 1/20th of a dose. So I spent a panicked morning calling people in Louisiana and telling them not to drive. But in general, with the mental health professionals, they've been saying that they've felt more empathy, and people report that there's been a change in like their root chakra. I'm not sure that I can fully explain what that means as a skeptic or whatever, but that people feel more grounded and feel a difference in their pelvic floor.
So I know that psychedelics are known for their tachyphylaxis, so rapid tolerance. Over the course of this study, did people have to escalate the dose over the course of the 200 some days, or were people constant with their doses?
People did not increase their dose. I mean, this one woman went from 1 to 3 micrograms, but people reduced their dose overall. I'm not sure what to say about in terms of if it's because they became tolerant or that the effects of microdosing aren't subject to the same kind of tolerance as macrodosing, but we don't see people escalating their dose.
My understanding of tachyphylaxis is that if you were to take multiple doses in one day or day after day after day, you would see it. But that's one of the reasons why the typical microdosing schedule is every 3 or 4 days, is that that avoids tachyphylaxis.
Yeah, and Amanda Fielding, I don't think she's here today. She told me that she was taking so much LSD back in the day that for her 100 mics was a microdose. She said that from the stage here last year. Yeah.
And you just mentioned the 3 to 4 day frequency for dosing. Did you actually run any subgroup analyses of you said you also allowed people to kind of use their own dosing frequency as well?
Yeah.
Did you run a subgroup analysis of if that 3 to 4 day period is actually more effective?
Yeah, so I did, but the lagged effect model isn't getting enough statistical power to be able to tell us anything. Because the doses are so different, we just don't have enough data on different days like that to be able to have a statistically valid result.